Actually, I'm very happy to be here because I was coming with good expectation as usual when I come to see Cameron and Marianne. And actually, the panel earlier today really made my day because I'm gonna talk about a project from Break Dengue, but Break Dengue is one of these partnerships we have been talking about. And so what we are doing in this partnership is we have one partner, which is my organization, the Synergies that I founded 3 years ago, to actually deliver this partnership. So we have one organization and our purpose is to make the partnership happen. So the partners participate, bring the expertise, the resources and the value, but we make it happen. We are the engine of the partnership. And recently in December, we were highlighted as a case study in the e-health report from WHO. At the time, it was because of our social media impact and online campaigning using these channels and telling sometimes complex stories to a very wide audience globally. And actually today I will speak about the next step about that, because we have such a reach with our channels. We are thinking we can do more than communicating with the audience. And so we have this issue which is actually highlighted, put on the table by WHO, which is about surveillance. Surveillance actually is one of the main challenges about dengue. It's a difficult disease to diagnose. And actually WHO listed these 5 points, which is about better monitoring system, better early alert systems, more integration of new data. All these aspects have been highlighted by WHO, and what we are doing, building on our reach, is to actually answer that question. And again, we don't do that as Break Dengue per se. We work with HealthMap and Harvard Medical Schools to make that happen. So we are the engine, and we were out there to connect with them and to find resources to make that project happen. And we think, and we bring our digital channels, but actually the brains behind that are HealthMap and the Harvard Medical School. So gathering data is the first element if we want to build surveillance. And so to do that, I'm giving one example, and you will see that all of this come together into a bigger picture later on. The first thing we have done, and this is a second iteration, because the first one we had a form where we were asking our audience to participate, but the form didn't work that well. It was too much of a request for citizens or people on the field to participate to that, because dengue is not such a big issue individually speaking. And so actually we built a chat on our channels, whether it's on mobile phone or on the web. And the chat is asking you a couple of questions very spontaneously. And so we know where you are connected from. And so we can bring to you some specific questions if there is a risk of dengue, if there is no risk of dengue. And then you, as a user of the website, you click on the answer that best fits your context. And actually by doing that, you don't even realize, but you help us putting one specific report on the map. You give us that information, but actually there is value in it for you. You receive a toolkit, which is exactly specific to your case. So if you have someone with the disease under your roof, then you have a specific toolkit for that. If you have no risk of dengue where you are, but you intend to travel, you have another kit for that. If there is no dengue around you for the moment and you just want to keep it away, there is a toolkit for that. So we have actually, these were the toolkits, and actually this is a decision tree with a question that help you lead you to one of the 5 toolkits at the bottom. And that's the value we give you as the user to participate. So we talk about mobilization, and very often that's a very difficult aspect to crack. And in this case, actually, we have with this new chat model, we have a 20% conversion rate. And if you compare it to the marketing benchmark for that type of activity, is actually 10 times better than what you would expect as a good conversion rate. Now, this is just one source of data, and actually there is much more, and we are talking now with different partners to bring other data. We talk about environmental data, economical data, we talk about vector data, of course, and so that's what we want to do, is to work on that and interpret it. Another piece of work we have been doing last year and we are about to publish very soon is with HealthMap as well, is to look at what people type in Google. The dengue-related research actually gives us a very good information about how important is a potential outbreak in your region. So in this case, you see the red curve is our predictive model, because we are not just analyzing the past. Based on the algorithm that HealthMap has developed, we can now predict 15 days in advance with a correlation of 93% in the 3 pilot countries that we have been doing. And so you now have not only a tool that allows you to do surveillance, but you have a tool that allows you to do a prediction model. And the idea is just one example. We want to combine 5, 6, 7, 8, 9, 10 sources of data to make that happen and to increase the duration of the projection. So we have this close to real-time data coming in. It means that we can have a close to real-time response using digital sources. And so in this case, that's what we do. So now I mentioned to you the chat a bit earlier, but actually with the data we capture, we re-put it in the system, so actually we can react to it. So if we feel, because of our data, that there is risk in your region, we tell you, we have data telling us that you are at risk of dengue. Have you heard anything? And so we start a kind of positive spiral where actually the data gets in the system, and then our audience on the other end actually validate it or not and give us another layer of information. So we increase the value of the system as we work with our audiences. The other element that might be really useful in the future is that we start to be able to identify hotspots. And so when we are in an outbreak period, and that's very useful to actually see where you should be active or not. Now, there are 6 reasons why this model brings, in terms of building on data and on the mobility, brings value. It's a push-pull. So it's not just observing or just giving. Actually, there is an enriching system where we play with the two. It's integrated, and actually the overall correlation of all these data sources will increase. So we are already with one source and 93% correlation. Imagine what we can do with 10 data sources. We integrate all stakeholders, so we have not done a Break Dengue tool that force everybody to join Break Dengue. Actually, we have made a system where health authorities locally can embed the tool on their website or on their app or on whatever channel they use. There is a productivity option with it. It's scalable, because the moment we have different sources, it's not a problem if Twitter is not available somewhere. It's not a problem if Google is not available in China. We might lose one source or the other depending on the region, but actually that's the combination of all of them that will allow us to be scalable quite quickly. And on top of that is digital, so the scalability will be easy to do. And the self-learning model that I explained. So this is one of the projects that we do in Break Dengue that fits this discussion. And actually I wanted to finish, and it's again linked to the panel discussion a little bit earlier. What we do with Break Dengue is actually valid for other diseases. So there is no reason, so our role in Break Dengue is to blur the boundaries between all the different silos for dengue, but actually there is no reason to limit it to that. And so why we come to ISNTD is also to open a dialogue and to say we have this type of tool and this type of capacity that could serve the community beyond dengue. Voilà, so the call to action is very simple. We are an open partnership, meaning that it's not an exclusive club. You can come if you have an article in gray and no pink for scientific. We have a scientific community with 1,200 experts where we can publish the article. We also have the channel to the public or to other type of stakeholders. So if you have material, we will use it if it's relevant for the content and our audience. So it's not an exclusive club. You can benefit from Break Dengue already just by coming to me or my colleague Aaron after this session. Thank you very much.